So how do you then encourage that conversation within the community?
This is so important to talk about, in my opinion. So as you can see, I'm South Asian. I grew up in a Pakistani family. I wasn't born in Canada. I spent my formative years in Karachi, Pakistan. And I'm very well familiar with some of the stigma that can exist within South Asian communities about mental illness. It's in a way, it's understandable, at least speaking from an immigrant perspective. Oftentimes, when our parents immigrated here, they had huge challenges in terms of just trying to survive financially and try to establish themselves. So I think there was less room for attention towards emotional and psychological well-being. It was really hard for that generation to balance all of these needs. So in a way, I understand how some of that developed. I think there's this other piece too, where physical illness is seen as more real or legitimate than mental illness. Oftentimes, physical illness is more, you can see it. If you have a fracture, you have a cast, you can see that. If you have blood work, there's a report that shows, okay, that means you're ill. In mental illness, it's not as clear as that. And I think that's why sometimes people can have a hard time taking that quite seriously. I think on the flip side, though, one thing that I'm personally really passionate about is I think some of our common mental health treatments or systems, they don't always understand the challenges of minority communities. Right. And so a lot of times when I've talked to patients or even people from my own community, they feel like they go and they try to seek some help, but they're not well understood. Their language might not be spoken. Their cultural specificities might not be understood. So I think it goes both ways. I think internally within our community, we need to talk more about these issues. We need to normalize talking more about emotional and psychological health. But at the same time, on the other side, as a psychiatrist and mental health professional, I'm also working on the other side, trying to make our systems more equitable and easy to access for people from diverse communities. So that can mean making sure we're offering services in different languages, that we might be offering groups, support groups that are specifically for certain communities, right? So there's work to be done, I think, on both sides.